definitely love seeing you.
I know, thank
You've
you.
been
I
the
like
most-
coming here.
Probably your roughest
Well,
patient too, wasn't it?
she was definitely an orthopedic challenge. I mean, you had so many injuries, you know, pelvis and long bones. It was just one long project with multiple surgeries, pelvic surgeries, multiple extremity surgeries that we did over and over again and adjusted. And we just recently got done with the hardware removal, and take the plates and screws out, and that really took some of the pain away and gave her increased mobility. But for somebody with a pelvic injury and bilateral lower extremity injuries, to recover to a functional level that she has is really amazing.
First time I came in here, it was in stretchers because I couldn't
Yeah.
walk for the first 6 months. It was in stretchers, and they would take x-rays and put me back on the stretcher, but then when I started walking in, they're like, oh my God.
Yeah, that was nice to see.
I like to make my
Seeing her
doctors
walking.
proud.
And
Were there any risks with the surgery?
well, yeah, she had significant risks. Well, survival first of all when she first came in, that was a challenge, and then repairing the pelvis and the long bones. That every single specific surgery you do always carries risks of bleeding, infection, a risk of not healing, the bone not healing properly, the hardware loosening. So, but
Looks like all the surgeries were successful.
yeah, she went through all of them very successfully, and the most impressive thing with her was that she went to physical therapy, and actually physical therapy, right?
Yeah,
I think you did it right here, yeah. And she just really gained range of motion very fast, a lot faster than what I usually see. So yeah, you were definitely the miracle.
Yeah, our
patient.
therapist and I would crank my knee and crank it to bend because it healed straight like this.
Yeah, and you know, you can see, I mean, she really has no stiffness, no contractures. She has essentially full range of motion.
90 degrees would be okay, and I said no way. 90 degrees is not good enough for me. And we were bending it to 138.
Yeah.
And now it's 148.
Exactly. She looks great in Dorothy shoes.
Yeah,
Blue.
Blue.
The blue Dorothy shoes. Yeah. So what are you going to do now? Go out and dance? Live life?
Yes.
Have fun?
I want to finally be able to jump in a pool and swim.
Right.
And go back to school. And then you'll be seeing me as a physical therapist in a couple of years.
Oh, good. Perfect.
Come work for you and Matt Smith.
Right.
And you're done with surgeries now, correct?
I believe I am finally. I don't want to say yes for sure because you don't know what will happen in the future, but as of now I am surgery free, thank God. After, I don't know, 34 surgeries, finally over.
Long time now.
So are you, as a doctor, are you happy with your handiwork?
Am I happy? Well, there's always room for improvement, right? But yes, I'm happy with her progress and her success and her outcome.
Me too. And I say he did the best, putting my puzzle pieces back together best than anyone could.
You know, the interesting thing is, and I use you as a model with my patients, I do a lot of work comp work, industrial work, and there's always this question about disability that comes up, and I always have to remind myself and then my patients about somebody like her that truly has injuries that you would think are incapacitating, and then, you know, we see you fully functional and not having any hindrance whatsoever as far as your mobility. And so I always use you as a model, and I tell them, look, this is what happened to somebody and look at her walk out of this office, you should be able to do that 10 times over.
Is this because she was
And
listening
this
to doctor's orders, or what? Why is her recovery been so great? What would you?
I think
attribute
it's
it to?
her own personal motivation. You know, it's your spirit to battle this problem and come out victoriously with it.
Yeah, I just want
But you got to put the work into it.
I put a lot of work. It was physical therapy for a year and a half straight, 3 times a week, 5-hour sessions, even sometimes 6 hours until they closed. And then I would go home and a lot of ice, and then just do it all over again tomorrow. And I loved it. I loved physical therapy. It got me out of the house. I got to meet new people, and
Well, you could probably see progress.
oh yeah.
Yes.
Yeah, when I could start, and then when I started running, I was like, okay, this is where my top goal was to run. And I was running with a little pain, but now when I ran a little bit before I ended physical therapy, there was no pain. It was just a little weakness from the muscles, but once I recover from this one, it's to the gym and on the treadmill.
So, doctor, any limitations?
I see no limitations, and I
Just
think
not
she's
running on anything hard.
well. Okay, I would say yes. Going jogging, long distance jogging, you can do it.
Mm-hmm.
I know you can do it, but I think if you want to spare your joints, I would probably pick a different sport.
Mm-hmm.
But she's definitely living proof. If there's a will, there's a way to recuperate from a trauma like this, for sure. She's a living proof of that.
Now if they say, you've been in an accident, I'll say, what accident?
Right.
There's never an accident. No accident.
Exactly.
So Jennifer's
Very
got to be
good.
thrilled.
No, I am
Yeah.
very, very happy and grateful that Dr. Vater was my doctor, and we've been together for this whole journey, and I'm just grateful for him.
This is your last visit?
I'm not sure.
You can always visit us. Bring cookies, hang out. You can
Be
do
inspiration to
yeah, you can be our inspiration department.
Physical therapy is the only pain pill you need.
That's
There
right.
you go. Yeah.
Yeah.
That's
So
better.
that's
And if you
good.
could please say and spell your first and last name.
Oh, my first name is Thomas. My last name is Vater, V like Victor, A-T-E-R.
And your title at UMC?
Orthopedic trauma and spine surgeon, and orthopedic department chief at the moment.
So, were you called in the night she came in to UMC?
Yes, I was on call.
What was your assessment when you?
Oh, I want to hear this.
What was my assessment?
Yes, when you first saw her.
Let's see. Usually, well, the way we usually see our first patients is in a trauma center. I don't know if you remember that or recall that, but probably not. And we bring you into the trauma bay and go through all the imaging workup after the patient has been stabilized by the trauma service. And once we start seeing the x-rays come in and the CT scans come in, we realize the extent of the orthopedic injuries, whether they're pelvis or spine or long bones like the bones in the legs, such as the femur or tibia, or in the upper extremities, the arms. And so that's my first impression of her, is broken, unstable pelvis injuries and fractured femurs and tibias. So the first thing we do is we stabilize the fractures with braces or sometimes external fixation devices.
I remember a boot.
Yeah, and boots and things like that, and traction. And then trauma usually stabilizes the patient in general. And you went to the intensive care unit, and then we started planning our protocol as far as which leg gets operated first, or which part of the body gets operated first. So we just kind of went through one body part at a time.
Does it usually go worse condition to
Yes, we fix them.
backwards?
We always fix the most unstable ones first, and then work your way down. For example, she had ankle fractures, but she also had the femur fracture, and we had to first fix the femur, so we have a somewhat stable leg before we fix the ankle.
And then this one.
I'm just amazed at
This one had a rod inside it that we put in. We put a rod inside here. This scar here was where the bone came out. And then the same thing here. We had to fix this. And this is the ankle fracture. This is the one that was rotted. I'm sorry, plated. We put a plate on it.
Then there's a lot of screws
Yes.
here that was very painful.
Yeah, this one had, most of the fracture was involving this part of the femur. And so we had to put a rod on the inside that went pretty much up to here and had a lot of screws going in on this side.
so
You've taken all
hold
that
on.
out?
Yes.
so I guess what I'm having a hard time picturing is the knees were not really broken up. It was just on all around it.
No, this knee and femur, she definitely had fractures involving this bone, which is called the femur. The distal part of the femur is the knee, and that bone was broken in several pieces.
But never a knee replacement.
No, not a knee replacement, no.
Oh yeah, so those are her.
Those are her
Binding
own bones.
cuts.
Bone knees.
Correct, yes.
Wow.
That's
Which
pretty
almost looks
amazing.
normal. All the swelling is almost gone.
Yes.
And then this knee wasn't broken.
No, this knee wasn't broken, but we went through here to put a rod inside. We kind of make a little incision.
It's almost
You can
gone.
barely see it, yeah, but you make a little incision here, and then you just sneak a rod inside here. And then these are little holes to put screws in to hold the bone to the rod.
And
These
rods
are
stay
taken
in.
out. You took these out.
Yes, and these are the ones we took out. The rods stay in.
Yeah. Wow.
And that's
so
how
if
you
anyone
fix the
kicks
bones.
this shin, they'll break their toes.
Yes, yeah. Let's hope nobody kicks your shin.
And those will never come out.
Not really. I mean, they can be taken out, but only if they bother you. But
Yeah, and this
For the
one
most
didn't
part.
bother me. It was just just this area that it kept locking, and it would hurt when I would walk for a long time. And now it's all gone. Now I feel 2 pounds lighter than.
right,
There's
right.
about 2 pounds of stuff in there, pound and a half with the screws and everything. This leg feels so much lighter than it was.
I mean,
All right.
Anything else?
well, I'm just super proud of her.
Thank you.
She's definitely one of our favorite patients for sure.
Absolutely.
Yeah, it's nice to see, the whole recovery process with you.
Yeah, because I'm telling me, we've been together since day one. Since
Yeah.
the day he was in the trauma
Trauma
room
center.
till 2.5 years later, almost 3 years.
So I will have both of you at the Trauma Survivor Celebration next year.
Oh, well, yeah. When is that?
We just had it actually.
May
May 29th.
But yeah, it's usually the last weekend.
Oh,
in
So next May.
Yeah.
next
And I
May.
had
But yeah.
surgery that day.